Bismillahirrahmanirrahim. In the name of Allah, who is the most beneficent and the most merciful. My name is Dr. Fakhar Hayat. You are watching our YouTube channel Medicose Fever. Today we will discuss about the disease of the pinna. In the ENT session, we will discuss the pinna and about its pathology or related to the disease of the pinna. First of all, we will discuss about the anatomy of the pinna. Anatomy of the pinna, mainly this part is the tragus. Here this part is the tragus. This part is the tragus, and here it is the lobule. This part is the lobular structure, and outer it is the helix. This is the helix. Total covering is the helix, and opposite to is the anti-helix. And if it is a tragus, and opposite to it is the anti-tragus. We discuss about the two concha. Number one is the Simba concha. Here it is the Simba concha, and it is related to the cave-like. If it is a cave-like, this is called as the cavum concha, and this is the triangular fossa. The most important about it is the pinna may be affected by the four things. Number one is the congenital, second traumatic, third inflammatory, other is the neoplastic disorder. Neoplastic means that's some cancerous tumor. Firstly, we will discuss about the congenital. First, the developmental abnormalities of the pinna, from the normal to the major abnormalities from the birth when the baby comes. Firstly is the anoxia. Anoxia related to the absence of the, this is the pinna, absence of the pinna is anoxia, and other is the microtia. Microtia related to the micro means little, and the macrotia is the decrease in the size of the pinna. Third is the bat ears. Bat ears means the protrusion of the pinna. Here the protrusion of the pinna is called as the bat ear, bat like. Is the loop ears, minor deformities, pre-auricular tags, and the sinus. This is the auricle, and in front of it is the pre-auricular, and the behind is the post-auricular. We will discuss the pre-auricular tags and the sinuses. Here this picture is the absence of the pinna, that's why called as the anoxia. Then this is a little bit microtia like. Now we will discussing the bat ears. Here these are the bat ears, mainly protrusion of the pinna. Due to the, this is the mainly anti-helix, due to the abnormality of the anti-helix, then it moves toward the protrudes, and this protrusion is called as the bat ears. Spectrum of constricted air severity. Constriction of the air constricted, this is the constriction of the air severity, and it moves from less severe to more severe. Here you see less severe to more severe. These are the tags and the sinuses we have discussed in the pre-auricular. This is the pre-auricular area, this is the pre-auricular area, and behind it is the post-auricular area. Here this is the tags, more tags 1 and 2, and the sinuses. Here this part is the sinuses. This mainly this is the inflammatory response and the abscess formation, and that's why. Number second is the traumatic. Traumatic may be due to some injury or due to mainly the boxers. When they box, they mainly injured the air, and hematoma, accumulation of the blood. I want to discuss accumulation of the blood. First, mainly this is our elastic cartilage. Elastic cartilage mainly formed by the chondrocytes, and outer layer is the perichondrium. This is the elastic cartilage. Our pinna is the elastic cartilage. That's why this is the perichondrium on the both sides of the cartilage. Here this is the cartilage and the perichondrium on the both side, and blood is accumulated between the cartilage and the perichondrium. The most important you want to be discussed is the perichondrium and the cartilage. Blood accumulates in the perichondrium and the cartilage. Here, this is the treatment plan: aspiration through the needle, and mainly this is performed by the surgery. Due to the traumatic, I want to discuss hematoma of the auricle between the mainly its perichondrium, between the cartilage and its perichondrium, between the cartilage and its perichondrium. Mainly because of this is the between the this is the perichondrium and the cartilage. Between the perichondrium and the cartilage, blood accumulates, and mainly its treatment is through the aspirated. If aspiration does not occur, then small surgical incision with the surgical drainage. Here its treatment is the aspiration. Firstly aspiration, then if aspiration cannot be done, then this is a small incision and the drainage. Here this is the mainly boxers, this is a boxer like disease, and because they want to push on them the other person, and there is a accumulation of the blood in the between the perichondrium and the cartilage. No, most important is the frostbite. Frostbite mainly due to low temperature. Because of the low temperature, there is a erythema. It between the erythema, edema, and the bullae formation, necrosis of the skin and the subcutaneous tissue. Skin and the subcutaneous tissue, there is a necrosis, and mainly rewarming with the most cotton plaquettes at a temperature of 38 to 42 degrees centigrade, and mainly it's the treatment plan. Application of 0.5% silver nitrate soaks for the superficial infection. Mainly this is the treatment plan. We do not want to go to the frostbite treatment plan. Here it is a typical example of the frostbite. Other is the keloid formation. Keloid mainly fibrosis leads to the keloid. Excessive fibrosis is the keloid formation. Mainly some ornamentals are used when there is a piercing of the for ornaments, and here this is mainly fibrosis on that side leads to the keloid formation. Here these are the keloid formation, and for some purpose there is a trauma or other due to the ornamental use, keloid may be occurs due to excessive fibrosis. These are the keloid formation. This is the keloid formation. Other is the perichondritis. Perichondrium-itis means the inflammation and the perichondrium. Inflammation of the perichondrium. Here, this is the inflammation of the perichondrium. I want to discuss with you about the perichondrium. Here it is the perichondrium. Inflammation of the perichondrium is called as the perichondritis. Symptom means red and hot and painful pinna which feels stiff. This is a pain, hot like and stiff like structure, and the stiffness due to it is the mainly. Its treatment should be the consist of systematic antibiotic because it's mainly because of the pseudomonas and the mixed flora are the common pathogens, because that's why we want to give the treatment plan of the antibiotics in the perichondritis. Relapsing polychondritis, because there is a relapse phenomena that should not be so discussed here. And sebaceous cyst formation. Common site, it's a post-auricular circus. Here is a pre-auricular and this is a post-auricular, and the post-auricular circle there is a sebaceous cyst formation, sebum production and the fat accumulated here. And the treatment plan here, this is the post-auricular, this is the post-auricular side, this is a post-auricular side, and there is a formation of the sebaceous cyst because of the blockage of the sebum gland, and there is a mainly accumulation of tag formation, tag accumulators mainly. Dermoid cyst usually present as the rounded mass over the upper part of the mastoid. This is the mastoid bone, mastoid behind the ear, and the upper part of the mastoid bone, dermoid cyst present. This is the dermoid cyst in the upper part. Here you will see the upper part, and this is the dermoid cyst. The most important is the we want to discuss about the neoplasia and we want to discuss about the squamous cell carcinoma and the basal cell carcinoma. Firstly, the most important is the squamous cell carcinoma. The site of pre-delication is the helix. It may present as the painless nodules or an ulcer with raised everted edge. Here, with the raised everted edge, painless ulcer with the raised. This is the painless nodules or ulcer with raised everted edges. Everted edges. This is the squamous cell carcinoma. Treatment plan, we will not go to the treatment plan. And this is the basal cell carcinoma. Its common sites are the helix and the tragus. It is more common in men beyond the age of 50. Beyond the age of the 50, it can lead to the basal cell carcinoma. This patient is you want to see the 50, above the 50, because of the white hair it is more old age, and that's why it is the more than 50, and this is the mainly as the basal cell carcinoma. Superficial lesions not involving the cartilage. Treatment plan we are not discussing. Melanoma, mainly pigment accumulation in the layers. Pigment accumulation is the melanoma. Melanocytes, this is the pigment, and the black like structure is the melanoma. Here is the melanoma. Melanocytes, mainly accumulation of melanocytes. Here I want to discuss the most comprehensive is this part is the, you wanna, for some time you think this is the bad air. Why it's called bad air? Because the protrusion of the, we are concluding it bad air. There is a mainly protrusion of the pinna. This part is, this is the keloid formation. Keloid formation, excessive fibrosis here, and the keloid formation. This is the typical case of the keloid formation. This is a mainly dermoid cyst in the, this is a mastoid upper part, and this is dermoid cyst formation. This is mainly the squamous cell carcinoma because of the painless and the raised everted edges. This is the melanoma. Thank you so much. We have discussed, and I wanna be comparing it with the that of the here. I wanna be discussed. The congenital we have discussed, traumatic history we have discussed, inflammatory responses, and the neoplastic disorders, squamous cell carcinoma, basal cell carcinoma, melanoma we have discussed. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicose Fever, and remember us in your prayers. Allah Hafiz.